So welcome everyone to Trent University's virtual fall preview. We are excited to welcome you to the nursing session. My name is Zachary. I am an enrollment advisor here at Trent, and I will be the moderator for the session. With me today, we have a lovely panel here. So we have Marianne Whitmore, who is the academic coordinator of the nursing program, Dr. Amy Halloran, who is the collaborative program coordinator, Dr. Kathy Thibault, who is the compressed program coordinator, Megan Rex, who is the Clinical Learning Center Coordinator, Zach Davidson, our Nursing Enrollment Advisor, Lucy Connolly, who is our Nursing Admissions Assessor, and two current students in the nursing program, Connor and Julia. We are excited for the path you have ahead of you and look forward to sharing all the reasons why Trent has been ranked the #1 undergraduate university in Ontario for 10 consecutive years. Think of today as the beginning of a conversation about you and Trent, and we look forward to continuing that conversation with you throughout the day as we meet faculty, staff, and current students. During this session, you can ask questions in the chat, and at the end of the session, we will have a short question and answer time with the members of our panel. I invite you to add your questions in the chat box, which you'll find on the bottom right-hand side of your screen, and our panel will also be answering those throughout the session. We're also going to be doing a draw for 3 Trent hoodies today. So just by attending today, you will be entered to win one of our 3 Trent hoodies. And in the live chat session today, we have members from housing, admissions, and graduate studies eager to answer all of your questions. But with that, what we'll do is we'll hop into the interview we have set up for our panelists. So right off the bat here, I have a question for Marianne. Can you explain the different types of nursing programs and pathways that Trent has to offer our students?
Yeah, thanks, Zach. So Trent University has, and the Trent Fleming School of Nursing has 2 different pathways at the Peterborough site, so the campus here in Peterborough. The first is a 4-year collaborative program, and we call it a collaborative program because our joint partner is Fleming College. And this program is intended for students who have no post-secondary education, so often students entering high school will come into this program. We also have a compressed program, so it's a 28-month program, and it's intended for students who have prior university level experience, and so they'll be able to have some transfer credits awarded to their degree, so they're able to complete the program in 28 months. Those students also would go through the summer semesters. We do have a 3rd program. It's a PN to BSCN program, and this is something that we work with George Brown College to deliver. Students would complete a 2-semester bridging program through George Brown College, and then would enter into our 5-semester program, and this is entirely hosted at the George Brown Waterfront campus.
Perfect, thank you for that. The next question here for Dr. Thibault. What is the Casper test and why is it required for admissions into Trent for nursing? And you're on mute, sorry.
Yeah, I do that all the time. Sorry about that. The Casper test stands for computer-based assessment for sampling personality characteristics. So Casper. It's a test that was developed by researchers at McMaster, and they developed it for use to help to screen applicants to their medical school, and they've been using it since 2010 to do that. Since that time, it's been adopted by other schools of nursing, other medical schools, other health profession schools, because it helps to assess the non-cognitive skills that an applicant might have. So what are the characteristics that are important for a health professional, someone who is working with people, and what do people have the characteristics that they require in order to be an excellent nurse? So it essentially allows schools to consider other strengths other than the academic strengths. And, things like communication and empathy and problem solving self-awareness, ability to collaborate, that kind of thing. So that's what the Casper test is doing, is assessing those characteristics. And it does that by, it's an online test. You take, you book a particular time to take it through the provider, and you answer a series of video and written scenarios. There are questions that are attached to each of those, and you have 5 minutes to respond to each question. And the results of this test are given to the admissions office of the school, of all the schools that you're applying to. So you identify which schools you want the results of the test to be sent to. The tests are administered at specific dates and times. So you would need to consult I think the first one is on November 4th. You need to consult, it's takealtus.com, which is the company that actually delivers the Casper test. And the cost is $40 plus $12 for each school that you want the results sent to. You don't see the results. That is something that people criticize about the test. However, right now that is the way it's set up, and we set a bar really in terms of admission. We set it fairly low, so we really use it just as additional information. We don't use it to out and out eliminate, large swaths of people. It's only one component. Yeah, I think that's it for the Casper.
Perfect. Thank you for that. The next question here I have from Marianne again. Is clinical placement offered in all years of the nursing program? And where would clinical placements be?
Yeah, thanks, Zach. We do offer clinical placement in all years of the program, in both the compressed and the collaborative program. It begins in first year in the second semester. From there, you will have 5 group placements. And so those placements are specific types of placements in specific types of environments. So first year is a residential setting. So often will be in like long-term care. We also sometimes use retirement communities as well. In second year, students will do 2 placements. One will be a community-based practice, and that was more of with a community partner. So it could be a huge range of partners, whether it's something like public health or a school, or even inside our own community here within the TFSON, and that's project-focused work. The other second year placement is Nursing 2021, which is a family-focused placement, and it focuses on a maternal child setting and the mental health setting. In third year, students also have 2 placements. So one will be in an acute setting and the other will be in a chronic. In the final year of the program, there's 2 semesters of independent practice. And so as opposed to moving with a group of students into the setting with a clinical instructor, students are actually placed at an agency more independently with a preceptor or a nurse that's there, and they'll complete 300 hours. For those final 2 placements, students have more opportunity to indicate the type of placement that they might be interested in, as well as the geographic location. Now, of course, we can never guarantee anything. Placements are always challenging for nursing schools to arrange, but if we can accommodate a particular type of unit or experience, then we work hard to do so.
Wonderful, thank you. And I also want to thank Lucy on the background. I'm seeing lots of questions coming through, and you're doing a great job keeping up to those. But the next question here I have from Megan. What types of Trent facilities will students be working in during their undergrad?
Awesome question, Zach. So students that are coming into Trent are going to engage and learn in an internationally accredited simulation center. We got accreditation about 2 years ago through SSIH, which is the Society of Simulation in Healthcare, which is an accomplishment that we're really proud of. We have 2 8-bed labs that are here. And all of our labs have diagnostic stations at each of them. So students will come in and engage and learn when there. We also have 2 4-bed labs that are also do double duty, being utilized as private or semi-private rooms for some of our simulations that we run. And a simulation is a clinical case-based scenario where we bring students in to learn and kind of role play as to promote that role socialization. What does it mean for me to be a nurse? How do I act as a nurse? How do I become that professional being? And it's that safe environment where we can make mistakes and celebrate those mistakes and work together to promote that learning piece there. So we have, like I said, the two 4-bed labs that we also utilize as the semi-private and private simulation rooms. We also have 2 primary care offices. They're set up as primary care offices. And we use those for some of our Ebola sims. And I believe Kathy also utilizes those for her mental health graduate certificate there too. So it's fantastic with that. So that's the type of rooms that we have. We also have a couple families of high fidelity mannequins that we utilize and bring into the learning. So we have our GOMARD family. We have Hal, who is a high fidelity mannequin. We have Noelle, she's our birthing mannequin. And then we have a baby Hal, which is can do crazy things. Every parent's worst nightmare. We can make this happen to this child and simulate. And we also have a pediatric mannequin as well that we bring into our assessments and simulations with our 2021 students that Marianne was mentioning is that family focused practice. We also have about 6 mid-fidelity mannequins that are workhorses, and we bring them right into first year, and students come in first year, first semester, right into the Learning Center to engage. So right starting, like I said, in first semester, they start engaging with some of the mannequins. We also use patient actors, right? Because that's the highest fidelity you're going to get an actual person. So that's pretty low tech, but it's great. And we have task trainers, which is, you know, I remember going through and using an orange to learn how to do an injection. So now we have different injectable pads or limbs and pieces like that, just ways to start IVs, medication administration, all of those things. We're looking at simulating both visual and hearing auditory impairments. So we have stuff for that too, just to kind of really provide that holistic experience for students when they come in.
Wonderful. That's amazing. And I always love hearing about the birthing mannequin as well.
Yeah, it's good.
But the next question here, I'll direct it to both Dr. Thibault and Dr. Halloran. The two of you might want to add on to this. So where do graduates of the program typically work after graduation?
Good afternoon, everyone. I can start, and then Dr. Thibault can follow and add on to my response. So I really think it's important to know that the possibilities for our graduates to enter into practice are numerous. There's lots and lots of possibilities, and nurses can enter different roles, and even throughout the course of their career, change the area of their nursing practice as well. So a large portion of new nurses enter into the hospital setting. So typically about 60 to 70% of new nurses go into work into hospitals, but other times new nurses will go into work into areas such as home and community care, long-term care, public health, mental health, rehab, and really those possibilities are far-reaching. So across Canada, we do have expectations that all new nurses will enter practice with entry-level competencies. So those are kind of our standard foundational knowledge, skill, ability to enter practice. And our program is approved on our graduates being able to meet those expectations, which really set the foundation for new nurses to go work in that large variety of different practice areas. I can share that within my own career, I've started working in emergency nursing in a large tertiary care center. I moved to smaller, medium-sized community hospitals to more rural facilities. And I moved to work within supporting education and policy practice, telemedicine, nursing informatics. I've even worked in nursing regulation at a provincial level and home and community care before working in academics here at the school. So I just think that that shows kind of those twists and turns that nurses can have along their path of their career. And with all of those turns comes lots of opportunity for learning and to explore different areas of practice.
I think the only thing I would add to that, Amy, is that just to recognize, I noticed a question fly by in the chat about the surgical placement, and I'm assuming you mean a surgical, like an operating room setting or something like that. So what I will say is that at the undergraduate level, at the baccalaureate level, we prepare nurses for generalist practice. So we don't prepare nurses for specialty practice. Now that's kind of that's the line, but students are often interested in a particular area of practice. So there is an opportunity in fourth year to perhaps find a placement or have a placement in an area that's of particular interest to you. But something like OR nursing is highly specialized and probably would not, whether or not you would have an opportunity to do that, it would be a very special event if that happened, a very special situation. It would require special relationships and supports present, but nothing's totally impossible. But essentially, we've tried to focus on preparing you for the entry-level competencies for generalist practice.
Okay, thank you. The next question here is for Dr. Halloran again. What is the NCLEX?
Oh, that's a great question. So for all to become a nurse and registered as a nurse across Canada and in Ontario, nursing students need to complete a registration exam. And the College of Nurses of Ontario has set the NCLEX RN as the registration exam. So that exam assesses a graduate's ability to meet those competencies for practice. So as I mentioned previously, across Canada, we have a standard set of expectations, those entry-level competencies. So the exam is intended to assess your ability to meet those competencies. So we actually, throughout the program, introduce students to the style of questioning that they use within the NCLEX to help prepare students. And as they get closer to the end of the program, that exposure to some of the preparation for that NCLEX exams increases, especially in our fourth year placements. So the NCLEX and passing that is one of the steps that you need to do to actually move from a student to become actually a registered nurse.
Wonderful. And on the topic of sorry, did you have anything to add to that?
Dr. Thibault, go ahead.
No, I don't know. Maybe you have the next question's going to cover it, so I'll just wait.
Yeah, sorry. I thought maybe I cut off Dr. Halloran there for a quick second. But the next question is for Dr. Thibault on the topic of the NCLEX. How does Trent prepare nursing graduates for the NCLEX?
I think it's important to recognize that the NCLEX, as Dr. Halloran said, helps to assess many of the entry-level competencies for practice. So that's what we do. That's the whole program is aimed at that. So we try to prepare you to learn to be to be able to take the kind of tests that the NCLEX is. So that's sort of a technical preparation. But in fact, everything that you do, where you're learning about nursing, how to work with people, how to respond, how to solve problems, how to think critically, all of that prepares you for the NCLEX. So it's a program-long process that begins in your first courses.
Okay, perfect. The next question here is for the other Zach in the room. Who should prospective students talk to if they have further questions about the nursing program?
Thanks, Zachary. So if students are interested in learning more about the program or have questions that they want to ask, we would recommend that you reach out either by email or by telephone number. So you can email nursingadmissions@trentu.ca. If your question is more focused on, the admission side of things, how to get into the program. If you're more interested though and have questions about the program itself, you can also always email nursing@trentu.ca. And if you do want to call, you can always call 1-888-739-8885. And also don't forget to check out our website, trentu.ca/nursing. There's some really great information on the web there as well too. And you can also find a link to download our nursing view book on that website too. So lots of really great information on the web.
Perfect. And then a couple questions here for our students on the panel, and then we will turn into a live Q&A. So the first question here for Connor. What do you love most about studying in the nursing program here at Trent?
Thanks, Zach. So I would definitely say studying in the nursing program here at Trent has allowed me to have a lot of flexibility within nursing and allowed me to explore a lot of different options. Currently, I'm working on research in the opioid crisis within Canada. It's something that I've always been really interested in and I've never had the opportunity to do. So now that I'm able to do this, I've really enjoyed it. I also think it allows you to go beyond what the bedside care is, and Trent really empowers you to do that. So I'm very happy to be in this program.
Perfect. And then the last question that we have is preset for Julia. Hard question. Why did you choose Trent?
I always kind of laugh when I get this question. I think I've worked with Zach in the past, and I think this was one of the questions he actually did ask in my interview. But I actually didn't initially, Trent wasn't initially my first choice for university, and my parents were really like set on me going. My grandmother was living in Peterborough, and it was just like, seemed like a great situation. So my mom really convinced me to go to an open house. It was in November. And I remember sitting in Wenjack and they asked like a question and they were like, I think it might've been like, who's the #1 like undergraduate school? And I answered it and I got a scarf thrown at me. And I was like, okay, great. Like I have a scarf now. I guess I have to go here. But in all seriousness, like I chose Trent because from like the minute I stepped on campus, I just had like an overwhelming sense of community and like welcoming, and it was just a really great environment. And for example, like all the faculty and staff you'll meet are so approachable and so helpful, especially in the nursing program. Like they're very, very good at like helping you out and supporting you. And the nursing program also like really specifically like had me really interested. I got to see all the labs in my open house and hear about like the different opportunities in the program. I was saying in the chat, like I got to take part in the Honduras placement virtually. So that was really great. It was a really great opportunity. And also like the campus is just so beautiful. It's really nice to be around. Like, as you can see in Zach's background, like it's very like, there's a lot of nature around, and that was really cool for me. So yeah, I think my experience with like going to the open house and kind of like hearing about different schools really goes to show that it's important to kind of look into different schools and like see different things, because you never know like what's going to happen. And obviously Trent now is my #1, but and I can't recommend it to enough people. Like I have had such a great experience so far, and I think it's important to know that with any school you choose, you're going to have a great experience. But I can say with absolute confidence, like the experience you have at Trent is unlike any other, and it's an amazing school and place to be.
Well, I love hearing that from our students. It makes me feel happy that you come here and you're thoroughly enjoying your time, enjoying your faculty, enjoying the campus. And I think that is a great turning point to transition to a live question and answer. So we do have about 8 minutes here. I know our students, as well as Lucy, have been fantastic at answering questions that have come through the chat already. If you have any other questions, or maybe your question wasn't answered, feel free to pop it in there or raise your hand. So Nora, you have your hand open. If you want to unmute yourself, you could ask your question out loud.
Thank you. So I was just wondering if you have many placements for palliative care, as I have had co-ops in high school and jobs with palliative care, and I really enjoyed that.
Hi, thanks for the question, Nora. I'm happy to answer that. So we have certainly have opportunities for palliative care placements. I think first off, I think of our 4th year when we do a pre-consolidation, which is about 300 hours of placement in one term, followed by a consolidation of another approximately 300 hours in the winter term. So I know we do currently have students that are placed within palliative care settings. But in advance of that, we also do our chronic care placements in our 3rd year. And that's another opportunity to work within some of our different settings and support palliative care as well, depending on the clinical site for that placement group too. So yes, there certainly are those opportunities.
Okay, thank you so much.
Maybe I could just add to that as well, is that students, in addition to the placement opportunities, students in fourth year have opportunity to select their supporting theory courses. We call them advanced topics. And one of our advanced topics is actually focused on palliative care. So that's another opportunity to sort of expand your knowledge.
Perfect.
Thank you very much.
On the topic of hands-on and placements, question from Bernadette: are there placements possible in the ER of a hospital?
Yeah, sorry, Amy, you've been answering a lot. So in fourth year and the pre-consolidation and consolidation, particularly, there is an opportunity for a placement as it's available. And if you are, if you have demonstrated that you can handle that more high intensity, rapid pace setting, but we certainly have students who are placed in emergency settings in fourth year.
Perfect. There's another question in the chat, and this is something that I have heard a lot as a recruiter, so I'll ask it here. Can you apply to medical school from the nursing program? And I'll add on to it a little bit. Is a nursing degree a good degree to apply to medical school?
Do you want, I can answer it if you'd like.
Sure, yeah.
So I suppose the straight answer is yes, you could apply to medical school from a nursing program. That is a possibility. It is a 4-year honors equivalent degree. But I would caution you in doing so and really give some thought. Nursing is a very different profession from medicine, and it's a profession unto its own. So and so when you're choosing to come into a nursing program, it is a highly competitive program. You would be taking a spot in a nursing program. And the other component is to, if medical school is truly where you want to go, this is a very rigorous program. We have a responsibility to make sure that we thoroughly and rigorously educate you before we release you onto the human population. But within that too, it is a challenging program, and medical school is quite challenging to get into. And so it may not be the easiest route to pursue in terms of meeting some of those high admission averages to get into medical school as well. I'm not sure if any of my other colleagues want to add anything to that.
Yeah, thank you. I think that was a great response, Marianne. It is certainly a different lens, I think, we view from a nursing versus a medical program. And so I think that will become quite apparent, you know, once you engage within nursing and kind of to grow yourself as a nurse. I think if someone's interested in kind of continuing in nursing education after an undergraduate degree, it's important to recognize that there are opportunities for advanced practice within nursing. And I can think of, for example, nurse practitioner programs, as well as our own master's programs and specialty certifications and diplomas that we're looking at within mental health, for example, and dementia. So there's lots of opportunities to specialize within nursing and continue to grow and become more advanced within your practice after the undergraduate degree as well.
Perfect. Thank you for tuning in on that. Another question here from Serena. I was wondering if the Casper exam is the deciding factor for acceptance into Trent Nursing.
No, it's not the deciding factor. It's one of, you definitely need to meet the academic requirements. And I will say that I'll read into why the question is being asked, but it's not something that you need to worry about. You know, if you have good human skills, good people skills, good experience in life, solving problems, meeting challenges, making decisions, you're going to be fine with the Casper. So it's not something to be afraid of. It's not, it doesn't kind of spit out your personality profile. It's not, you know, hopefully if you're a psychopath, you know, you won't get a great score, but you know, a real good psychopath would probably know how to beat the Casper and do really well. So it's not that kind of a test. It's really looking at what skills you have. And so you just, you know, you're in the test, you're answering in the moment. So it is not the only indicator or criteria for sure.
Wonderful, thank you. And the last question we'll take here as we're nearing the end of the session, and this one I could direct to Zach. What are the courses needed in grade 12 to be accepted into nursing?
Oh, how exciting. It's my time to shine. Yes, so the courses that are required, and Lucy, you're just lightning with the responses there. Thank you so much. But you are going to be required to have English, biology, chemistry, and math with a average of 70% in each of those courses, as well as your next top 2 best for URM courses. And just keep in mind, folks, that those prerequisites that we require for the nursing program, those are going to be calculated into your admissions average for the nursing program, as well as those next top 2 best. Another thing that I did want to mention is oftentimes, and correct me if I'm wrong here, folks, if this has changed, but oftentimes your nursing average is actually going to be different than your scholarship average. So your scholarship average will actually could be higher than your admissions average to the nursing program. But chances are, if you are getting into our nursing program, you are almost guaranteed to get our entrance scholarship as well too, because that starts at an 80% average, and that's usually where our competitive average sort of ranges. So if you're getting in, you're also getting a scholarship, which is a pretty nice thing to know.
Wonderful, thank you. And it looks like we have reached the end of our presentation. I would like to take a moment to thank the members of our panel for being here with us today and sharing their knowledge with us. This session has been recorded and will be posted to our fall preview webpage next week if you wish to review the session again or any of the other sessions that took place today. I would also like to invite you to come and visit our campuses. We are hosting in-person campus tours at both our Peterborough and Durham campus. The Peterborough campus is the campus that houses our nursing programs. And if you're interested in booking a tour, you could do so by going to trentu.ca/tours. I would also like to invite you to our fall open house happening on November 20th. So if you have any other questions percolating in your mind between now and then about nursing, we'll have another lovely nursing session there. So more than welcome to come back and ask those questions. And we do look forward to connecting with you and answering any of those questions you may have. Enjoy the rest of your day, everyone. And thank you again to our panelists for being here today.